One of the biggest things that I see now when completing these applications is just missing information, and it delays, ultimately it delays days, sometimes weeks. My name is Jenna Gardner. I am the Rev Cycle Coordinator for the MAP and PAP department at Vanderbilt. I've been here for almost 7 years. MAP is Medication Access Program, which is our in-house financial charity program for prescriptions. Basically, anybody that goes to one of our pharmacies that can't afford their medication, has a medication that's not covered by insurance, or is uninsured, can apply and be approved for this program. It's a financially based program that allows them to go to our pharmacies and fill their medications, and they won't have any out of pocket. PAP is patient assistance program. Throughout the hospital, anybody that needs assistance that is offered through a drug company, they send a request to my team, and we evaluate whether or not they qualify and get them signed up. We monitor the entire process as far as literally from start to finish. We help the patient with the applications. We send the applications to the programs. We monitor the refills and the drugs coming into the hospital, as well as once their enrollment ends, whether or not they need to be re-enrolled. Day-to-day for me is monitoring message baskets for patient assistance requests, making sure that the requests are accurate and they truly needed, and then kind of dispersing that out to the team. I also do internal audits weekly of my team to kind of make sure that their processes are correct, as well as I order the drug for, we call them replenished drugs. So any drugs that are given in an outpatient setting in our outpatient centers that have to be infused or injected, they come here to this location, and I order those patient assistance drugs each day. And then we have a person that actually receives the drugs when they come in from the companies and kind of disperses them out to the clinics. So I graduated high school, and at that time had just had a baby and needed a job. I had planned to do nursing, enrolled to go to nursing school, and needed a job and went into Walmart, applied, and I mean, it was almost a saving grace, but the lady that interviewed me said, "How would you like to be in pharmacy? I see you're interested in nursing." And I was like, sure, why not? So I worked there for about 3 years, uncertified as just a state registered tech, taught myself, learned, with others, and then took my test and got certified. And I kind of just fell in love and just kind of moved my way up. Literally every 2 to 3 years, I would take a new position and kind of find something else that I liked until I ultimately landed here. With retail, it wasn't enough. I like to learn new things. I like the investigating side of pharmacy, and I just kept trying to find that. And when I landed here, I was ultimately doing prior authorizations, and I liked that because you kind of had to dive into therapy plans or policies with insurance companies. And I always liked the digging and finding. And then once they opened up coordinator roles, it kind of was like, well, I could do that. I can manage a team, and I really enjoy it. My team works well together. I enjoy the aspect of doing the auditing and the teaching and the learning. So it just kind of happened, but I definitely worked my way up throughout the years to kind of land in this spot. You definitely have to have patience, definitely have to have great customer service skills, willing to call and speak to patients, especially elderly patients that don't understand why you're calling and why you want them to complete this 4-page application. So customer service is huge. Also, attention to detail. One of the biggest things that I see now when completing these applications is just missing information, and it delays, ultimately it delays days, sometimes weeks. for missing one check on an application. So just getting information correct and then knowing your dosing and things like that. We are more.